Since the start of the pandemic, the Ministry of Health has been at the forefront, leading the charge to contain the cases of COVID-19. The Central Medical Lab has been processing samples, or security forces have been enforcing quarantine regulations. And behind the scenes, mostly working from home, the Social Security Board has been processing the growing claims for persons who are deemed incapacitated due to COVID-19.
We have well over 3,000 cases positive for COVID-19. That reflects persons that are working, that reflects older persons, and also reflects, unfortunately, persons below working age. From January to October 25th, we have had 1,012 submissions for sickness benefit for COVID-related illnesses. Now, when we say COVID-related, it includes persons that are on mandatory quarantine. It includes persons that are on isolation by the Ministry of Health, and it includes persons who are active COVID-19 cases.
Interestingly, over half the benefits paid out by S.S.B. as of October 25th are for persons who didn't even have COVID. Cancino explains.
We cover persons that are certified to be in quarantine as a result of COVID-19. So the Ministry of Health determines, the Ministry of Health is the body that determines this. So if you are in quarantine awaiting a test result and the ministry certifies that you are a suspect case or a suspicious case, then they will certify that period, and Social Security does cover that under sickness benefit. Of those 1,012 cases that we have received so far for COVID-related illnesses, 459 of those were paid to persons in isolation, and 411 were paid to persons that are actually positive for COVID-19. 103 were paid for virus not identified, which is a classification for suspicious cases but not yet confirmed positive. And 23 of them were paid for contact and exposure. So that is essentially the breakdown of cases. When you calculate the cost of that, that's a little bit, or just about $500,000 in payouts thus far. It's important to note, though, that the Ministry of Health is a little bit behind in the submission of these forms. Well, of course, the amount of work is overwhelming for them. And so we still have a lot of persons that are waiting for their periods of incapacity to be certified. So this number is certainly expected to grow significantly.
Based on the claims they had processed, the average recovery time for COVID is 2 to 4 weeks. The longest sick leave due to COVID has been 6 weeks. She noted that the current protocol still dictates that a person must test negative before returning to work. However, it was announced in August that this would be amended to match the World Health Organization's recommendations. As for the anticipated spike in claims, as Cancino noted, not all of the 3,000 plus active cases would be eligible for sickness benefits. However, as you can see in this breakdown from the Ministry of Health produced on October 19th, when active cases were less than 3,000, the largest number of confirmed cases were recorded in people between the ages of 15 and 50, the population most likely to be employed. As the Ministry of Health clears up the backlog, the S.S.B. expects to see much more claim submissions.
The ministry is in the process of catching up right now. So I think we will see a significant surge in claims between now and this November and December. Unfortunately, funeral grants and survivors claims. So we are already paying out survivors' pensions for COVID-19, survivors of COVID-19 persons. And we've already paid out 13 funeral grants for persons who have died as a result of COVID-19.
Recently, the S.S.B. has shifted claim submissions entirely online.
We are now accepting claims fully online, which means that you can submit your claim from your home or from your phone and have it paid without ever having to come to the Social Security office.
And how has that transition been going so far?
It's been going well. Like most new processes, we've had our challenges. The process is a little bit more onerous on the claimant because you as the claimant needs to ensure that your claim is completely filled And there's also the salary record that you need to get from the employer. For COVID and COVID-related illnesses, doctors are submitting medical certificates directly to Social Security online. So the person does not need to go to the doctor, does not need to come to the office to submit a claim. The doctor will do it on your behalf.
All claims can be downloaded from the S.S.B's website, and a scanned copy or photo of the form should be emailed to claims@socialsecurity.org.bz. Cancino urges claimants to be sure they fill out every section of the form accurately. Be sure to complete the prior employment segment, provide your current employer's name and email. Double-check that your email and phone number are accurate, and ask your doctor to send you a copy of the medical certificate or to copy you into the email submitted to S.S.B. You can call the office or message them on Facebook for further assistance.